Here at Penn Medicine, we've been getting a lot of questions about the COVID-19 vaccine and what it means for our patients and the people in our communities. I'm Dr. PJ Brennan. I'm the Chief Medical Officer at Penn Medicine, and today I'm going to answer some of the most frequently asked questions around the COVID-19 vaccine. Let's get right into it. First, a few questions about how we're handling vaccinations here at Penn Medicine. I really want to get a COVID-19 vaccine, but I'm not able to get an appointment. What should I do? People are understandably anxious about how to get a vaccine. I would encourage everyone to go to the websites of the states of Pennsylvania, New Jersey, and the city of Philadelphia to determine whether you're eligible to get a vaccine. You can also go to the Penn Medicine website to register your desire to be vaccinated. Those sites will provide information on eligibility and can notify you when your turn comes up to be vaccinated. At Penn Medicine, we're trying to administer vaccine as quickly and as fairly as we can, following the guidance provided by the City of Philadelphia, the Commonwealth of Pennsylvania, and the State of New Jersey. On to our next question. How does Penn Medicine decide which order to vaccinate people in? Well, first, we're following the guidance provided by the Commonwealth of Pennsylvania, the State of New Jersey, and the City of Philadelphia. Each of those jurisdictions have provided for us categories of the population that need to be vaccinated. And the 1A category is the one that we started with first and includes healthcare workers and those who are living in long-term care facilities. We've now moved on to the general population. And in that category, 1B, we're vaccinating people that are in essential infrastructure roles in our society. And at the present time, those over age 75 in Philadelphia and 65 in the surrounding counties in New Jersey, and those with serious underlying medical conditions. There are many people who have high-risk conditions, many more than we have vaccine for at the present time. But as vaccine supplies increase, we'll be reaching out to all those people to try to vaccinate them as quickly as possible. What are some of the challenges involved in vaccinating lots of people quickly? There are a number of challenges that we face. The first is the supply of vaccine. It has been rolling out slowly, and we expect over the next 1 to 2 months that much more will be available. And when we have more available, we'll be able to reach more people. But in the meantime, there's a lot of uncertainty about when we're going to be getting the vaccine, and that creates challenges for us in scheduling people. If we don't know we're going to have a sufficient supply on Monday, it's hard to have a full schedule of individuals to come in and take their shot. Another challenge is reluctance. There's a tremendous amount of reluctance and hesitancy about the vaccine. We're doing our best to educate the community and encourage everyone to come in and get their shot. And then finally, there's active misinformation out there that is really misleading. And it's important to come to Penn Medicine or another trusted, reliable source of medical information in making your judgments about whether you should be vaccinated or not. What kind of progress are you making on getting vaccines to everyone who wants one? I think we're making great progress. We started in mid-December offering vaccinations to our frontline healthcare workers. It started slowly, but has really begun to pick up, and we're hopeful we can get more vaccine quickly into people's arms as the supply increases. We're also very concerned about the Black and brown communities near our hospitals and in southeastern Pennsylvania and New Jersey, communities that are historically underserved. And so we're reaching out to communities of faith and others to try to help us serve those communities and give them the shots that they deserve. I've heard that people in Black and brown communities are less likely to get vaccinated than others. Does this concern you? It does concern me. Black and brown communities have been disproportionately affected by COVID-19 and historically have been underserved medically. So I'm very concerned that we're not reaching those communities to the extent that we should. We have offered vaccine to everyone in our workplace, just as an example, regardless of their position, regardless of race and ethnicity. We're trying to deliver vaccine as equitably as possible. And we've been measuring the uptake in different demographic groups, and it's very clear that our Black and brown staff are not accepting vaccine at the same rate that other communities are. So we're working very hard to try to bridge that gap. We're having huddles in the workplace. We're reaching out to individuals of color to encourage them. We have doctors and nurses and other staff as influencers who are reaching out to our communities of color in our health system trying to bridge that gap. So we've made progress, but not enough progress. And I expect that as time goes on, we will make more as confidence in the vaccine increases and people see that it's safe and that the side effects are not significant. So I'm hopeful that we will close this gap. Now, here are a few questions around the safety of the vaccine itself. Can I get COVID-19 if I get a vaccine? There is no live virus that causes COVID-19 in the vaccines that we have. So you cannot get COVID-19 from the vaccine. There's still a lot we need to learn about the vaccine. One of the things is whether it actually prevents infection or whether it just diminishes the severity of disease. We hope that it does both, but it may be possible that someone can still get infected and be asymptomatic and shed the virus. So for that reason, we're continuing to maintain all our public health measures until we know more about whether the vaccine actually prevents infection or not. One of the most common questions we get asked is, I've heard the side effects are bad, particularly for the second shot. Should I be worried about that? Reactions to the vaccine are pretty common, but they're mild. They may occur more often in some people after the second shot than the first shot. They seem to occur more often in younger individuals who may have a more robust immune system and be better able to react to it. But those reactions are important. Those reactions indicate that you're responding to the vaccine, that you're having a positive effect that's demonstrating that your immune system is reacting and you're going to be protected. The reactions that we see are generally mild headache, mild muscle aches, sometimes a low-grade fever. And they do occur more often with the second dose of the vaccine, but I want to contrast that with the virus itself. These are relatively minor, whereas the infection can be very severe. So I would encourage everyone to take the vaccine, not to stay away from it because of these reactions that indicate your body is responding to it. What will it take to get to the point where everyone is safe from COVID-19? Well, in order to get to a point where everyone is safe from COVID-19, we have to bring down the transmission of the virus in the community. So how can we do that? First, we have to continue to adhere to the public health measures that we know are effective. Masking, distancing, avoiding large cohorts of people, using good hand hygiene. And we have to vaccinate as many people as possible. It's really a race against time. The more people we can vaccinate, the faster we can get to herd immunity. Herd immunity is the level of immunity in the population where most people will be able to fend off the virus so that if a case is introduced into the population at large, it's going to keep bumping into other people who are immune, and it's not going to spread like wildfire as it has since the beginning of the pandemic around the world. So that will take time. I expect that it's going to take many more months. Vaccine will roll out and we'll have more available to us, certainly in March and April and thereafter. And if we can continue to vaccinate at the pace that we're moving and then accelerate that, more than 1 million doses a day, 2 million doses a day, I'm hopeful that by the fall, we can return to football stadiums and concert halls and classrooms that are full with students where we have the level of herd immunity that everyone needs, if we can keep up with vaccine supply and if we all accept the vaccine. In the coming months, I expect that there will continue to be a lot of questions around the vaccine, and we'll be here to provide the best and most current information available to help our patients, employees, and our communities.